I've come along today to see Dr Ian Strawford, who, following a consultation with him, has advised me that he can help me to improve my hair loss on the crown of my head using quite a natural process and using my own blood cells. And whilst I would probably not opt for a full hair transplant process, I find this quite natural using my own resources, and I think it would help my aesthetics and make me feel good.
The process of treatment involves taking your own blood and using a very sophisticated system to be able to separate and extract the platelet cells from the rest of the blood plasma. We call this platelet-rich plasma, or PRP. And when injected back into the skin or the body, this high concentration of platelet cells has a profound natural stimulation to the area where they're injected. So you lie back down, we'll take a bit of blood. It's a bit like you're going to the GP, it's just a bit of a good syringe full of blood. So we're loading the first syringe of blood into the Magellan True PRP system. The system's just starting up through a process of a very gentle centrifuge in the first instance, just to start to separate the cells. So within our blood, we've got the red blood cells, which obviously give it the very red colour, the haemoglobin from the red blood cells. You've got the platelet cells within the serum, and within the serum there are also white blood cells that help to fight infection. So we're going to predominantly separate the red blood cells from the rest of the serum, and then the machine can start to calibrate and separate the platelet cells into a separate volume, so that we end up with a serum that is two parts of the serum. One part that has very high numbers of platelet cells, up to 20 times the blood concentration of platelet cells per mil of serum. There's no other technology I know on the market at the moment that can guarantee me that level of platelet concentration per mil. We'll also end up with a platelet poor serum, which is still has some platelets in it, but has predominantly the white cells, the cells that fight infection, and we will use that as well as part of the treatment to help, but most of the stimulation is going to be done by the platelet-rich plasma. Vampire hair restoration is utilising the natural growth factors that are present within platelet cells through the PRP fraction. We're injecting very tiny amounts of PRP throughout the scalp in the area where you may be experiencing thinning hair, losing density of hair, and the first signs of baldness. We're now going to use the meso gun to give the PRP into the scalp. This is a gun, an automatic gun, that will fire the needle in so quickly under pneumatic pressure that the skin will not feel the needle going in and out. So there's very little, if any, discomfort at all. But it enables me to put very small, tiny droplets of the platelet-rich plasma, or PRP, with the growth factors over the scalp, all the area where we're seeing there's some slight thinning of the hair here. And the aim of that is to get the hair follicles in that area to stimulate, to produce new hair, more hair, and healthy, thicker hair. Okay, so I'll just start at the crown here and inject very small amounts. Tony, you may feel a little tiny bit, but hopefully very little.
No, it's okay, it's good.
PRP works by stimulating the hair follicles. It stimulates the hair follicles to regenerate, to produce a greater density of hairs, as well as a better quality of hair, a thicker hair. So it's often used prior to hair transplantation by hair transplant surgeons, and has been shown to be effective in maintaining the transplanted hair. I use it commonly prior to people requiring hair transplantation, but many of my patients come to see me prior to ever considering such procedures, and many don't want to consider such procedures. So it's an ideal treatment in the early stages of hair loss, for both men and women. It's interesting because it's been about 6 weeks now since you had your vampire hair restoration with the PRP.
Yes.
And I had a text saying you were really pleased that things were starting, you noticed some growth coming, which is excellent. Let me just have a quick look and see. Yeah, I can see some good thickening of the hair up here, Tony, and certainly I can see there's some new hair starting to grow as well. Some new hair follicles that are shooting out some new hairs, and it's certainly at this point showing some good signs of improvement starting to come, which is what we'd expect. And the process can take up to a good 6 to 9 months following the first treatment.
Okay.
I think we can see, looking back at your picture here, that there is definitely a thickening starting to happen, especially in the frontal area. That's probably coming at the first at this point in time.
Yeah, I've had one haircut since I saw you, and I definitely noticed the front end of my forehead, if this part, thickening almost within a few weeks.
As I said at the start, we anticipated that you'd probably need more than one treatment.
Sure.
You may need a second treatment, but we always wait a good 6 months following the first treatment to make sure we've got the maximum amount of growth, because it is a gradual process, and we'll reassess at that point in another 3 or 4 months' time to plan to do the second treatment, if needed at the time. But looking really good, really positive at this stage.
Yeah, I'm really happy.
Great.
It's good progress.
Okay.